Live from Studio 7E in Rockefeller Center, this is News 4 New York.
And later, several steps every person should take if they're considering plastic surgery.
All right, John, still to come. If you're considering a plastic surgery procedure, there's a very important checklist you need to know about.
Now time to talk about plastic surgery, and oh how times have changed. Plastic surgery is no longer frowned upon, nor is it just for the wealthy, which means more people than ever are saving their pennies for a little nip there, a tuck here. No matter what procedure you're considering, though, surgery is very serious and you need to be well informed. Renowned plastic surgeon Paul Lorenc is here to share what he calls 5 beauty killers to avoid. Good morning, Dr. Lorenc. Thanks for joining us this morning.
Good morning, Erica.
So first, the new stats just came out. What are the most popular procedures these days?
Well, according to the statistics by the American Society for Aesthetic Plastic Surgery that just came out last week, the #1 surgical procedure just overtook liposuction is breast augmentation.
Okay.
As far as non-surgical procedures, Botox by far.
No surprise there.
No, 2.5 million procedures last year in the U.S. alone.
Wow. So in your own practice, which is right here in Manhattan, how do you consult with people who are coming in? Do you see people who want too many procedures? What kind of screening do you do?
Well, we have what we call the Lorenc Skin Fit program in my office, and we screen the patients with a photo analysis, and really it's a very broad spectrum prescription ranging all the way from surgery to non-surgical prescriptions such as fillers, neuromodulators or Botox at this point, laser resurfacing, and all the way down to skincare. So it's a really wide range of procedures, and it's really up to me to recommend to each particular patient what's appropriate.
Okay, well, we want to get to your 5 beauty killers. Now, in terms of what you have been seeing, you say make sure that you don't keep any information from your surgeon, you know, when that comes to drugs, even homeopathic
even green tea. Be brutally honest with your surgeon, with your prospective surgeon. Tell him or her everything. What drugs do you take? Prescription and non-prescription. Do you smoke? Have you had previous surgery? And even things such as green tea can make you bleed post-operatively or intraoperatively. So be absolutely open.
Yeah, don't be shy, okay? Even if you don't think it has an effect, it may. Okay, your second tip is never read it and believe it.
There's a lot of disinformation out there, and I think the internet plays a very positive role overall, but also some negative information. So be careful. Always be hesitant to believe everything that you read. Do your homework. Verify what you're reading, and the resources are right there, so use them.
And researching kind of goes to your third tip, which is never select a surgeon based solely on their certification. Dig deeper.
Much deeper. Board certification is a very nebulous term. It has to be a board certification recognized by the American Board of Medical Specialties. So you have to find that out. But nothing replaces experience and training of a particular surgeon. So if you're having a facelift, make sure that that particular surgeon has done a number of facelifts in the past.
And it's not just the surgeon you have to worry about. Check on the anesthesiologist.
Just as important as the surgery is, the form of anesthesia or who's giving you anesthesia is very important. Over 80% of procedures, cosmetic procedures right now in this country are done outside of the hospital. So do your homework. Is the facility an accredited facility? Is the anesthesia provider a board certified provider? So you, as a prospective patient, have to do that homework ahead of time.
And quickly, don't just go for a deal. This reminds me of those plastic surgery vacations everyone talks about in the Philippines, Costa Rica, Mexico. They're going on vacation to get these procedures because they think they're getting a good deal and they get to relax, but that's not true.
This is not shopping for a sofa. This is your face. It's very important. Do your homework preoperatively, not afterwards. And again, don't look for a bargain. Look for a well-qualified, well-trained, board-certified surgeon to do your surgery.
Okay, thank you so much for being here this morning, Dr. Lorenc. Thanks for the tips.